Kawempe division is characterized by uncontrolled developments that have given way to growth of the slum. High HIV/AIDS prevalence rate at 8.9%, constant flooding, congestion, coupled with an insecure environment. Life here is urban poor lifestyle, where amidst all this, crime is not out of the ordinary in a day-to-day life. The incidence of HIV/AIDS here has explicitly been intensified by high occurrence of poverty levels in the community. The scenario has complicated attempts to provide lasting solutions to health and other problems for residents.
Kawempe is a rural area, so the factors which lead to acquisition of HIV are many here. It's a poor community, it is a rural, there are many slum areas, and there are also many migrant people, migrant workers who come here. So all the risks for HIV are there.
This makes it prone to unending epidemics of cholera and malaria during the rainy seasons. There are limited facilities here with one government health center, the nearby National Referral Hospital, which is certainly overwhelmed. More so, there are problems of access and funds for transport, lack of funds for health care, coupled with no money to pay for clinical investigations and medicines. HIV/AIDS, or the slum disease as it was known, first came to light in the mid-1980s and has since then had devastating effects on all aspects of life of many Ugandans. In the Kawempe community, the disease is still flourishing with a prevalence rate of 11.8%, way above the national average of 7.3%, according to the Ministry of Health Survey 2012.
Most people here are migrant workers from all over the country. They do not have any social support, they don't have any relatives or family around them, and once they get sick, they are not able to work and pay their rent or buy food which they should before that they usually. And these are people who actually survive on what they produce or what they earn on a daily basis. So when people get sick, they really become so vulnerable, they stay there homeless, they are dying, there's nobody to look after them, no one to cook for them, feed them, talk to them, clothe them, etc.
Despite the vast amounts of resources that have been committed globally to eradicate the epidemic, there is still no cure to date, and patients have to rely on daily doses of antiretroviral therapy that slow down the multiplication rates of the virus, enabling the persons infected to live fairly a healthy life. At Kawempe Home Care, Dr. Sam Guma, together with the work team here, start the day with an early morning session of yoga, meant to stimulate their minds and set them for the day's activities. It is a Thursday of the week, a day when they will go to the field for routine visits to clients, but more so to offer palliative care to the patients, some of whom they will find at home because of their health condition.
Many people who get sick are not able to get up and go to hospital. There are problems of transport, problems of accessing health services, and all those really kind of frustrate the patients, the caregivers, the families, and the community to have this person seek medical services. So when actually a medical team goes to a home and provides care, it really does a lot for the family and the community.
The yoga session is followed by a case conference in which a review of the condition of every sick patient is done. The work team has established a routine where each client's file is reviewed to determine their situation before setting off for the home visits.
The clients come from the community through the community network of care. We have a group of community workers. Then reaching at the site, they are registered and straight they are sent to counseling. It is at counseling where they are tested, and those who are found HIV positive, they are sent to the clinic, they are examined more, and then enrolled on our program.
Home visits will include going to the patient's home and doing a holistic assessment of their illnesses and managing the physical, psychological, social, and spiritual aspects of their illness. A multidisciplinary team of careers that comprises doctors, nurses, social workers, counselors, and community volunteers visits the patients at home.
No single person can provide these services alone. You need to have a clinical person, you need to have counselors, you need to have community people, you may need to have spiritual leaders, you could need social workers. All of them have got a role to play in providing holistic care. And here actually at Kawempe Home Care, we've got a variety of those people who help us provide the services to the community as part of the multi-disciplinary.
The team works closely with the family and community to provide care for the patient.
We've seen people benefiting a lot, especially with our community volunteers. I mean, many of them are people who are living with HIV, and they have seen the benefit of this kind of service. And once they go out and they support people, they actually use themselves, they give their own testimonies of how they have benefited from this service. And that in itself encourages people who are on antiretroviral medication or on TB medication to actually try to cope with the volunteers and be like them.
Palliative care is a necessary component on the KHC program because some of the patients here have HIV-related opportunistic infections like fungal meningitis, HIV-associated cancer, or tuberculosis. These conditions cause a lot of pain and distressing symptoms like cough, headache, vomiting, profuse diarrhea, and others. Palliative care approach helps to control pain and distressing symptoms, thereby improving the quality of life of the patients.
Say you've got a patient who is bedridden, who is in pain taking oral morphine, the health workers can go there, but they spend some time, maybe 20-30 minutes, talk to the patient, tell them how to take their medication, but the community worker who stays behind or who comes to support really reinforces those messages and ensures that the patient is taking their treatment the way they're supposed to.
Barbara Namirimu, one of the patients of Kawempe Home Care, a 20-year-old, was diagnosed with advanced AIDS and tuberculosis, also with Kaposi sarcoma. She was started on antiretroviral therapy, anti-TB treatment, and was referred to the National Cancer Institute, where she started receiving chemotherapy. She had severe pain in her lower limbs and was started on oral morphine by the clinical team. Barbara had, before coming to KHC, sought treatment from nearby hospitals and health centers and didn't get much help. Barbara's situation was one of pain from the TB and cancer, but also other psychosocial problems like lack of food, school fees for her child, and rent for the mud and water house that she lived in with her mother, brothers and sisters.
Yali amaze ebbanga nga ali ku glucose na dalos ate nga n'okumala mutampeku nga bakuyambye nnyo bahafu ne kasita yatuwa empeke za TB n'atandika okulya n'atandika okunywa.
Amidst the distress, she came to Kawempe Home Care following advice from a neighbor to her mother. Medical care, including home visits, food support, and other support were provided. 3 months later, she passed on due to advanced illness, but pain and symptoms were controlled, which gave her a dignified and peaceful end. Community network of care is the system used to support and care for the bedridden clients right in their homes. The community volunteers, also called victors, give basic nursing care, wash patients' wounds, clean their bedding, cook food, and monitor adherence through pill counting. Good adherence to the medication is highly essential to prevent resistance of the virus to the antiretroviral medicines. The community volunteers link up the patients in the community to the health facility. For both TB treatment, the volunteers also do community-based directly observed therapy, DOT, to ensure that the TB medicines are taken as prescribed to give good treatment outcomes and prevent the occurrence of multi-drug resistance to tuberculosis.
Oba oliawo omuntu nga yalabako omuntu we wamujjanjaba n'agamba nti eddwaliro liri Kawempe era asooka ku nze teri yali asooseeko wa Dr. Samba asookera ku ffe ba community workers kuba kati ffe tuli common mu kitundu era oli olukulaba n'agamba omusawo wange wuuyo.
Tuyina olupapula luno lwe tuyita weekly report. Buli wiiki tulipootinga olupapula luno tulireeta wano ne tuba nga tuwaayo betulabye nti ono alina ekizibu ekitemu ekiti. Olupapula luno lulaga nti omuntu ngenzeyo ne mulaba ne lulaga nti omuntu ono amize bulungi eddagala oba teyamize bulungi kuba nze mba mbalansinga okusinziira ennaku z'omwezi yavuddeyo ku ddwaliro. Kati bw'aba yamize bubi nina okwongera omusomesa nti munnange wano bw'otomira bulungi waliwo ekivaamu ekirala.
Many have their lives back, but others may fail due to given circumstances, like poor social support resulting in travel back to their home villages, where the medicines may not be available.
Our medical interventions actually really do a lot for the patients. We've seen people really getting a lot of improvement. They come in when they are very sick, almost dying, and some of them have gone out to become, to get really much better, and they go back to be able to live a proper livelihood as they were before. And actually we've done a bit of research on our program, and we found out that almost 89% of our patients who are put on treatment and on antiretroviral therapy actually survive after 1 year of treatment.
At the center of Kawempe Home Care's approach is the end-of-life care and bereavement care for families that lose their beloved.
We also do supportive counseling, as in encouraging the caretakers to continue taking care of the patients, and we support them up to the end of their life. We do grief counseling and bereavement support. Sometimes it's obvious that any of us at any time will die, but we help this client to die when he or she is at peace with the family members and other friends.
The home care now has 1,177 active patients, 70% of whom are female and 30% male. 539 clients are on the antiretroviral therapy, and the home care is now offering palliative care for 10 clients with cancer. The condition and the antiretroviral medication requires an added diet of nutritious foodstuff for the patients on treatment. With such low-income earners, only few of the people can afford the food, and many may fail to continue on the treatment. At the home care, positive living is encouraged among patients, including restraining from drug and alcohol abuse, refraining from extramarital relationship and unprotected sex, that is all termed risky behavior. KHC emphasizes this to help patients cope with their HIV/AIDS and other health challenges. At times, what could go for frustration, sadness or grief becomes a learning point.
We have observed people gaining life, but we have also seen people dying within our hands. That has not discouraged us. Instead, this deep experience, it has helped us to save more lives.
Certain situations are difficult to handle, like discordant couples. At times, it's getting people, family members, to overcome the fear of becoming infected if they are not already known to be. It may be the anger and blame for the infection that are directed towards the patient. It may be stigmatization and discrimination of the patient, family members, friends, and other caregivers. And such life-threatening illness has economic impact on the main family wage earner. Home care faces the challenges of keeping the orphans and vulnerable children who are either patients themselves or have lost their parents due to the disease. At the home care, 100 children receive support ranging from food, scholastic material, financial support in form of school fees and other basics.
They clearly have a tangibly strong relationship with their service users, as well as the wider community that sit around their work. And I think that means they're more capable of responding in a sensitive and also a sort of complete way to the needs of the community that they work with. I'm also particularly impressed with the way that Kawempe engage and work with children, the mothers, and those who are probably the most marginalised within the rural communities they work with as well.
KHC started income-generating projects such as bead making, mushroom growing and piggery to support poor patients who lose their means of survival due to HIV/AIDS.
We train them in bead making. We have done recent training in mushroom growing, but also on the side of enterprise, we give small grants for them to start income-generating projects or businesses like selling the mushroom market stores, food vending, and all that.
Through this initiative, the patients can provide education to their children, food, clothes, and have self-esteem as a result of having a stable self-sustaining employment.
I can see them getting to even a bigger number. That is for one. I see them expanding to a bigger level. I also see Kawempe Home Care diversifying activity beyond the usual HIV/AIDS, TB and cancer to general health care. I know this is happening, but not at the scale where it could get to.
I want it to grow and have a clear linkage from the time you get the person whom you want to bring up, or the sick person, to the time when you've made that person okay and what that person will be in the future. So we look at sustainability, growth and sustainability, economic emancipation of our clients. We want them to be able to generate and support their families and themselves. So our dream is really to grow into a respectable organization, a charity organization, grow and reach other areas that we have not reached, and have a reputation of a caring and hope field organization.
We're actually surprised that we're able to do so much considering how few our resources are. And that's again comes back to the kind of model that we're developing. We're trying to show the world out there that we can do a lot with even a little that is available. So our friends out there should not be discouraged about resources so much, but once you're willing to provide a service in the community, you can really go a long way even with few resources.